Hello and welcome to this introductory case study in this course, Revenue Cycle Management Excellence. So in this lecture, we will talk to you about a case study of becoming an excellent healthcare revenue cycle management professional, like you would like to do probably, right? So let's take a look at this case study. So this is a interesting case study, which is basically crafted, designed, written to help you as an individual understand what does it take truly to become an excellent healthcare revenue management professional, healthcare RCM professional. So let's dig into this case study, right? So name mask, face mask. This is about, let's say, Priya Verma, who is a bachelor's in commerce and has been working for 2 years in general administration, right? And but her aspiration is to become a skilled healthcare revenue cycle management professional, RCM professional, and she works out of India, working in a US-based healthcare BPO organization. Now, in her aspiration to become a healthcare professional, healthcare revenue management professional, RCM professional, that too in skilled and excellent, she knew she faces certain challenges. Now, what are these challenges? She knows that she knows, billing steps, but not the logic behind them, right? And she is struggling to find, identify claim denial patterns, and she is not able to interpret payer rules or improve clean claim rates. That is the difficulty. And she feels stuck in repetitive tasks without, being able to analyze things. And Priya wanted not to just process the claims, she wanted to become someone who could then reduce denials, improve collections, and strengthen the entire revenue cycle in her company, and thereby making much larger impact than what she's doing currently. So that is this case study about. So let's dig into the challenge a little more detail. So it's a clinic with rising denials. Now, Priya was assigned to a US multi specialty clinic whose denial rate shot up to 19%. And that's very high, right? That means one fifth of the claims submitted weren't getting denied. Now, this affected the income and the patient satisfaction, obviously. Now, when you want to dig into this, and when she dug into this, the main pain points were like errors in pre-authorization, incorrect demographics of the patients, and the wrong code modifiers or errors in coding. And there were specific rules given by the payers that were getting violated. And the claims were not appealed on time when they were denied. They took that did not happen well in time for them to get revised and submitted and paid. And as a result of that, there was high patient AR, accounts receivable, due to poor financial communication. So those were the difficulties, issues that the company was facing. And her manager told her, as a result of their conversation, is that your job is not to just push claims. Your job is to eliminate the cause of the denials, right? And that set Priya thinking at that she has never been trained to think at this analytical level. She's been trained to process the claims, but to think beyond this, identify and reduce the denials as a percentage of the claims submitted was something that she need to now learn. So what was the turning point in this whole thing? Now, Priya decided to understand why the claims were falling behind, the first step in turning into a problem solver. And for that, she studied the full RCM flow step by step. And that included what you see here is patient scheduling, insurance verification, prior authorization, coding, capture of the charge, submitting the claim, posting the payment, And then comes if the claims get denied, managing that denial, done by following up the AR and patient collections. And she discovered in this whole process of reviewing step by step this entire RCM flow that RCM excellence is actually a managing every step proactively, not reactively. And because things can go wrong at every step, right? Any step for that matter. So what you need to do is to manage every step proactively to become excellent in RCM. So what did she do? She investigated the 19% denial mystery. And for that, she did what we could call a mini audit. She decided to look and examine what were happening and where was it happening. And she, as a part of that, what she did was in the first step, she did the analysis of the deep denial categories, and she categorized the top 300 recent denials and found many interesting things, as you can see here. Uh, Eligibility and coverage was the top issue with 38% share, and the causes of that, as you see here, were the rushed verification, outdated payer portal checks, etc. So there were five top causes, five things that happened that caused the top 300 recent denials. So that was the first deep denial category analysis. And she presented this breakdown to her supervisor, and that was a bold move because this was not part of her job earlier of processing claim. This was something that she could have been told, why are you doing this? But the management wanted her to look into. And then, as a result of this analysis and discussion, she found three invisible leaks. Like, what were these three invisible leaks? Invisible. They were not able to see it earlier. Now, these were the problems that other teammates have not been able to find. And what were these? Patients' name mismatches with the Medicare, right? Middle initials missing, say, for example. One pair updated policy for diagnostic image coding, right? And nobody noticed it. So being in line with the updates of the policy of the payer was another thing. And auto-rejected claims were appearing in the team dashboards, were not appearing in the team dashboards. So auto-rejected claims were not visible in the dashboard. And this showed her growing pattern recognition ability of being able to detect what was happening that is causing the denial rate to go up. What did Priya do? She used a RCM excellence framework called ACT. And what did she do as a part of that? Let's go take a look at as we go forward now. So first thing she did was to start anticipating because she needed to manage proactively and fix the front end issues. So she created templates and checklists where she verified every patient's plan type, active dates, and copay and deductible. Wrote guides, mini guides for the peers on top 15 coding errors, and set up daily authorized expiry check, all for chronic patients, and created patient rule sheet which were updated weekly basis. Right. And what was the result? A result of that was the eligibility related denials dropped from 38% to 17% in 6 weeks. So the cause, when addressed, started making the impact on the outcome that she wanted. Second thing was to correct faster in terms of faster clean claim submission. And what did Priya do there? She, took many initiatives. Now, what were these initiatives? She built an Excel dashboard showing claims that were stuck for more than 72 hours, right? And she added color coded flags for such high risk claims and worked with coders to validate new CPT's ICD 10 changes, the change in the coding change, and they were not reflected in the way they were coding. And the result was that the timely filing denials dropped by 60%. Clean claim rates improved from 78% to 91%. So that also resulted in significant impact on denial rates. The third thing she did was to transform, using analytics, an intelligent denial prevention system. And she used simple analytical techniques, right? Like uh, heat maps to show peak denied days, you know, trend lines to identify recurring pair issues, pivot tables to find root cause patterns, right? Simple as pivot tables, and a simple predictive model estimating which claims were likely to be denied based on the past patterns. And what was the impact? The AR days dropped from 52 days to 38 days within 3 months. And this was the single biggest KPI improvement. So, what was the breakthrough moment in this case? It was, as you will see here, a $150,000 recovery. Now, Priya discovered that a set of high value cardiac claims were denied repeatedly for medical necessity, right? Very vague term. So, what did she do? She took many initiatives. She checked payer medical policy updates, gathered notes, operative notes from physician, and appealed within stronger words and submitted a batch level appeal result. Right. And what were the results as from this action? These actions, the payer reversed the decision and $150,000 were recovered, right? And she was promoted as an RCM analyst. So this was the moment she realized that she had to become a problem solver, a problem solving RCM professional, not a claim processor. So she had to go from a problem to the success. She has to ride through the solution that can solve the problem. So what did Priya learn? That every one of us must learn as RCM professional. First, that RCM excellence is thinking, not typing, not processing claims. And here, data skills matter more than the speed, right? Then, second thing is that we need to understand the full RCM cycle. RCM isn't starting at billing, it starts at scheduling. The third thing is you should master the payer rules. Policies change every quarter, right? And excellence requires vigilance and knowing what are the payer rules. The fourth is to build strong analytical rules. Need to know that dashboards are better than reports, insights are better than summaries. So we need to work on insights. And root cause are far more important than symptoms. We need to find the root causes of the problems that we are facing. Then we need to communicate with providers. Solving denials often requires physicians' clarification and communication of those clarifications to the providers. And finally, you need to prevent, not correct, because the best RCM professionals stop denials even before they occur. So let's take a look at an RCM professional excellence ladder that you can also use to climb up. So it starts as a processor where you enter data, and the key thing is accuracy and speed. Then once you have this proficiency, you can move to executor where you submit clean claims and the workflow proficiency is what matters. Then you can become an analyst. You need to become an analyst and identify the denial trends, analyze, and then the key skills that you need and you need to develop is analytics and pattern recognition, which is what we saw Priya do in this case, right? And then you become a strategist where you prevent the future denials. And there you need to have cross functional coordination skills. And finally, you can become a business partner that can improve not only the claim submission success rate, but also improve the revenue. And where you need to develop the financial impact mindset. So, Priya, here we see move from level one as a processor to strategist in less than 1 year, right? So what's the outcome? What was the outcome in this case? The denial rates reduced from 19% to 9.8%, roughly half. AR days reduced from accounts receivable, the amount reduced from 52 days to 38 days. The days it took time to recover the money from the provider reduced from 52 days to 38 days. And $150,000 was recovered through analytical appeals, right? And as a result of all that excellent work, Priya was promoted to RCM analyst, and she continued to focus on denial prevention. And she became the team's internal trainer for denial analytics. The skills and expertise always gets recognized. So what is the final insight? A excellent RCM professional doesn't chase denials. They study patterns, predict failures, and prevent revenue leakage. And your ability to analyze, participate, and improve processes, determines your success to RCM in RCM, not how many claims you process, right? So what do we do next now? So we will get on at looking at how to become an excellent revenue cycle management by studying the revenue cycle management and all those steps. And we will take an overview of that in the coming lecture and a few lectures, and then take you through each of those as we go forward. So thank you so much for watching this introductory case study in this course. I hope you're continuing to learn new things, continuing to enjoy, and I do look forward to see you again in the next lecture. Please feel free to message me if you have any questions. I'll be happy to answer your questions, and do download the PDF file to take a look at anything that you need.